Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through medical terminology of integumentary system. Part C, surgical, diagnostic and therapeutic procedures. Question number 1. A surgeon performs an escharotomy. This procedure is best described as A. Incision into a burn in order to lessen its pull on the surrounding tissue. B. Removal of a basal cell carcinoma. C. Debridement of a pressure ulcer. D. Removal of a fingernail. Think the answer. The correct answer is A. Incision into a burn in order to lessen its pull on the surrounding tissue. The term escharotomy is a medical procedure derived from two Greek roots. Escha means hard, crusty, burnt tissue, that means necrotic tissue, that forms after a full thickness, that is third degree burn. Otomy is a suffix meaning surgical incision or cutting. Question number 2. A physician performs a procedure to obtain a small piece of tissue from a suspicious lesion for microscopic examination to determine if it is malignant. This procedure is called as an A. Cauterization, B. Incision and drainage, C. Biopsy, D. Debridement. Think the answer. The correct answer is C. Biopsy. A biopsy is the removal of tissue for microscopic viewing. Opsy is a viewing to make a diagnosis. Question number 3. The surgical removal of fat is documented as A. Retidectomy, B. Lipectomy, C. Dermabrasion, D. Autograft. Think the answer. The correct answer is B. Lipectomy. The term lipectomy is built from a combining form lipo, that is fat, and the suffix ectomy. Ectomy means surgical removal, so meaning the surgical removal of fat. Question number 4. A full thickness skin graft taken from a patient's own body is an example of an A. Xenograft, B. Allograft, C. Autograft, D. Heterograft. Think the answer. The correct answer is C. Autograft. An autograft is a graft taken from a patient's own, that auto means own, body. Allo and hetero refer to grafts from other sources. So allograft is a graft taken from another person of same species but not genetically identical, such as from a donor. Xenograft is a graft taken from a different species, example pig skin to human. Heterograft is another term for the xenograft that also mean from different species. Question number 5. The surgical procedure involving the excision of a nail, often performed for an ingrowing nail, is A. Onychotomy, B. Onycholysis, C. Onychectomy, D. Onychophagia. Think the answer. The correct answer is C. Onychectomy. Onychectomy combines the terms onycho, that means nail, ectomy is excision, so meaning the surgical removal or the excision of a nail. Question number 6. A procedure to remove dead, damaged or infected tissue to improve the healing potential of a wound is called A. Incision, B. Debridement, C. Suture, D. Morph surgery. Think the answer. Correct answer is B. Debridement. Debridement is a surgical or medical procedure used to remove dead, damaged or infected tissue from a wound. Question number 7. A woman undergoes a procedure involving the surgical removal of the entire breast, which is coded within the integumentary system subsection of CPT. This procedure is an A. Mammoplasty, B. Mastopexy, C. Mastectomy, D. Lumpectomy. Think the answer. The correct answer is C. Mastectomy. Mastectomy combines the term masto, that means breast, and ectomy, that is surgical removal, so meaning surgical removal of the breast. Question number 8. A patient presents with lesion suspicious for a fungal infection. The physician performs a scraping of the lesion and a lab analysis to confirm the presence of fungi. This procedure is generally referred to as A. Sank smear, B. Skin culture and sensitivity, C. Skin scraping for cough preparation, D. Punch biopsy. Think the answer. The correct answer is C. Skin scraping for cough preparation. The skin scraping for cough preparation is a standard diagnostic procedure to quickly identify the presence of fungi elements, that means myco, in the skin lesion. Question number 9. The procedure often performed to release the fluid or pus from a cyst or abscess is abbreviated as A. ID, B. IND, C. CNS, D. TNA. Think the answer. The correct answer is B. IND. IND stands for incision and drainage, a surgical procedure that involves making a cut, that means incision, to allow fluid like pus to flow out, that is drainage. Question number 10. The therapeutic use of liquid nitrogen or another very cold agent to freeze and destroy tissue, such as a wart or skin lesion, is termed A. Cryosurgery, B. Electrocautery, C. Dermatoplasty, D. Phototherapy? Think the answer. The correct answer is A. Cryosurgery. Cryosurgery involves the use of extreme cold, that is cryo, to destroy the diseased tissue, that is surgery. Electrocautery means uses electric current to burn or coagulate tissue. Dermatoplasty refers to surgical repair or grafting of the skin. Phototherapy involves the use of light, usually ultraviolet, to treat skin disorders such as psoriasis. Question number 11. The surgical procedure to smooth the skin by sanding or scraping away the top layers, often used to lessen the appearance of scars or fine wrinkles, is A. Chemoabrasion, B. Dermabrasion, C. Lipectomy, D. Excisional biopsy. Think the answer. The correct answer is B. Dermabrasion. The dermabrasion is formed by the term derm, that's a combining form meaning skin. Abrasion is a suffix meaning scraping away or wearing down. Therefore, the term literally means scraping of the skin. Question number 12. A skin graft where only the epidermis and a portion of the dermis are transferred is called a. Full thickness skin graft, B. Split thickness skin graft, C. Pedicle flap, D. Free flap. Think the answer. The correct answer is B. Split thickness skin graft. A split thickness skin graft contains the epidermis and only a portion of the dermis. A full thickness skin graft includes the entire thickness of the dermis. Question number 13. A biopsy procedure where a small circular tool is used to remove a complete core of tissue down the subcutaneous vest is called A. Shave biopsy, B. Incisional biopsy, C. Punch biopsy, D. Excisional biopsy. Think the answer. The correct answer is C. Punch biopsy. A punch biopsy uses a sharp tubular instrument, that is punch, to remove a cylindrical piece of skin, providing a full thickness sample, that is epidermis, dermis, and sometimes subcutaneous fat. Question number 14. A surgical revision of a scar that involves making an incision to change the direction of the scar and minimize its appearance is known as an A. Z-plasty, B. Skin graft, C. Debridement, D. flap closure. Think the answer. The correct answer is A. Z-plasty. Z-plasty is a surgical procedure to revise a scar by creating a transposing two triangular skin flaps to lengthen the contracted scar or change its direction, make it is less noticeable. Question number 15. The non-excisional destruction of tissue by applying heat through an electric current is termed A. Cryosurgery, B. Curettage, C. Electrocautery, D. Laser ablation. Think the answer. The correct answer is C. Electrocautery. Electrocautery uses heat generated by an electrical current to destroy, that is cauterize tissue. Other answer, cryosurgery uses cold. Question number 16. Mohs microscopic surgery is a technique used primarily for which purpose? A. Applying skin grafts, B. Diagnosing benign lesions, C. Removing malignant skin tumors layer by layer, D. Correcting wrinkles. Think the answer. The correct answer is C. Removing malignant skin tumors layer by layer. Mohs surgery is a precise surgical technique used to treat skin cancer, primarily basal cell and squamous cell carcinomas, by excising the tumor layer by layer and immediately examining each layer microscopically until all cancer cells are removed. Question number 17. The therapeutic procedure involving a light source to treat various skin conditions, including acne, psoriasis, and vitiligo, is generally referred to as A. Cryotherapy, B. Phototherapy, C. Dermabrasion, D. Chemoabrasion. Think the answer. The correct answer is B. Phototherapy. Phototherapy or a light therapy uses various forms of light, that is photo, such as UV light or specific wavelengths for treatment. Question number 18. In documenting the removal of a suspicious skin lesion, the procedure is described as a wide excision. This term implies A. The lesion was benign and small, B. The excision included a narrow margin for normal tissue, C. The excision included a generous margin of normal tissue, D. The lesion was removed with a shave technique. Think the answer. The correct answer is C. That is, wide local excision is the excision including a generous margin of a normal tissue. The wide excision is performed to ensure the complete removal of a lesion, usually malignant, meaning a generous margin of healthy surrounding tissue is also removed to minimize the recurrence. Question number 19. When a wound is cleaned, debrided, and left open to heal by filling in from the bottom up without the edges being approximated, this process is known as healing by A. Primary intention, B. Secondary intention, C. Tertiary intention, D. Flap repair. Think the answer. So the correct answer is B, secondary intention. The secondary intention healing occurs when a wound is left open, example, due to tissue loss or infection, and heals by granulation tissue formation, wound contraction, and epithelialization. Question number 20. The surgical term for making a cut or opening into tissue is an A. Excision, B. Incision, C. Suture, D. Debridement. Think the answer. The correct answer is B. Incision. An incision is the act of cutting into tissue, but an excision is a removal of tissue. Bonus question. The surgical procedure to lift and reshape a ptotic, that is tagging breast, is an A. Mastectomy, B. Mammoplasty, C. Mastopexy, D. Lumpectomy. Think the answer and leave your answer in the comment section. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel, and if you have any doubts or any questions, you can put in the comment section, or else you can email me or you can WhatsApp me. Thank you.